Hey, good afternoon, good morning to everybody. It is 2 o'clock on the dot. I am on the East Coast here. I'm going to give it a couple seconds to allow everybody to get off their last Zoom call to join this Zoom call. Thanks so much for participating. We'll be back here in a second. Okay, we're going to get started. 2:01. We'll let people join as they get on. So thank you so much for everybody joining, and welcome to episode 1 of PinPoint Plans. We hope today is going to be a not only enlightening, but we're going to try to have a little bit of fun with this whole health benefits conversation. So in this conversation, we'd like to always start with, what do we want you to get out of today? And so if you hear nothing else today, we want you to take away these top 5 things. And so one, you've heard it said a lot of different ways, but we're in a new norm. The reality of the system right now is that it is going to impact healthcare costs, not only for the remainder of this year, but well into next year. And we're going to talk about why and how and how to even budget for things like that. Number 2 is we really saw an access to care conversation really come into play. I think everyone's heard about telemedicine and virtual care, but the reality of it is really trying to understand how we need to be looking at quality and access to healthcare was a really big thing. Number 3, we're going to have you look at and show you reasons why the current model just isn't going to save the day, and obviously why PinPoint Plans was created. Number 4 is all of you employers on the phone, that these strategies that starts and foundationally is grounded with being self-insured is going to generate not only a cost savings measure, that cost savings measure is going to translate especially to the CFO in regards to cash flow and actual escaping cash, getting cash out of your current healthcare system. And then 5, and definitely one of the things that I think we don't talk about enough is the relationship between cost and quality. And unlike everything else, healthcare is actually inversely related, where most of the time, the better the quality of the healthcare, the lower the cost it is. So today we're going to talk about and do a little bit of a level set. We're going to introduce you to PinPoint Plans, the why, the what, and the who. We actually am super pumped about this. Got an employer and one of their employees on to hear firsthand experience about how this plan is going for them. And then we're going to talk about here coming up forward. So whose voices will you hear? Unfortunately, mine for a while here in the beginning. My name is Lester Morales. I am the founder and CEO of Next Impact. And with me, I have the real people, the muscle behind PinPoint, 2 AccuSure agency partners, Trent Harper and Sarah Klein. And then, as I mentioned, a client and one of their employees, Joanna and Jeremy, 2 people that are living this, and they're going to introduce themselves. As for me, guys, I am a little bit of a employee benefits nerd. I've spent all of my life in this field. My degree is actually in risk management and insurance. And these, what I will call high performing health plans or non-standard plans, is 100% of what I do. And I am super pumped to be partnering with the AccuSure Agency Partner Network and creating what we have termed PinPoint, because this is the first time we'd actually been able to pinpoint exactly what costs look like and adding a key word into the marketplace, which we're talking transparency. So we wanted to start with some level setting. And one of the questions we're getting a lot right now is around transparency, or is around COVID, and really trying to dig into transparently why COVID or how COVID is really going to impact the cost here. And so I wanted to start with some level setting to say, across a very large book of business, if you look at claims volume, so as everybody knows, you pay a premium dollar to your carrier then turns around and pays claims with those dollars. Or if you're already self-funded, your plan is paying the heaviest part. Typically 80 to 85% of every dollar is spent on claims. Well, claims volume right now, looking at this year, is down significantly. So I looked at this in a couple of different ways. So we had a nice year last year, so we added new clients. So the first, quarter, if you will, almost, through March 15th, we actually had a claim volume increase. We added new lives, they incurred claims, and so therefore we had an increase. If I look at from that day, the 16th of March, when I think everybody will remember where they are, because I think that's where most people went into some sort of lockdown, claims volume has decreased significantly. So if you look at from that time to now, a 38% decrease, or year over year, this time last year versus this time last year, we have a 45% increase or decrease. But really what is alarming, and alarming in a way that your cost should reflect this, is that 55 nearly percent decrease in the number of pre-authorizations that are going through. As you know, pre-authorizations is what is really driving most of these services that are increasing the cost. And so you'll look here to say the portion of the spend that is attributed to the coronavirus. And so not necessarily something that is an overwhelming amount, but this was some actuaries trying to predict the impact of COVID. Now, when we look at this and say the actual cost, so, hey, what happens if I have an episode with COVID-19? How much would that have cost me? And so what we took is the CPT codes, the actual transaction codes, what services people actually have when they get diagnosed with COVID. And we looked at that and said, how much does it cost? And so if you look at that and said, all the way from the billed amounts, so think of the billed amount when you get that invoice from the hospital and the real big number that you're like, whoa, I didn't realize healthcare was so expensive. That number is looking around $73,000. What the insurance company actually, the allowed amount is $38,000. But you'll notice what Medicare is, and what I want you to take from the Medicare conversation is that's around what it actually costs the hospital to perform those services, is $10,500. So for all intents and purposes, COVID isn't overly a expensive scenario. And because of the percentages of people, especially under the Medicare age, so most of the impact of COVID has been with an older population north of 65, and we tend to see those people on a Medicare plan. But for you employers out there, your commercial plans, you're probably not seeing too much effect from a day-to-day, dollar-to-dollar standpoint with COVID. And the problem that we're seeing right now is, so what is COVID going to do to your renewal? And so there's a host of things out there that people are trying to guess, but most of the articles and the requests that we have seen from the health insurance companies to their state departments are on the low end, mid double digits. So let's call that 12, 13, 14, 15% to as high as 40% of an increase. So the reality of this conversation with COVID is there is 100% going to be backlash from COVID. if it's not about COVID from a cost standpoint, from people actually having COVID, it is the reality that most imaging, most diagnostics, most surgeries, most elective things were put on hold for several months. And so those things are still things that people are going to actually have done. So when you think about that, it's not that somebody's colonoscopy or their knee surgery or their hip replacement isn't going to happen. It's just that it got delayed. So now the conversation is, how do we impact the rest of the year into next year to make sure that this lowering of claims that we had for the beginning part of this year doesn't impact us negatively, or said a different way, we take it and impact it positively. So in being so excited about getting started, I forgot a couple of housekeeping. So you'll notice that on the top panel there is a Q&A button. Please, everybody, at any time, if you do have any questions, please submit your questions. We actually have a section that we're going to stop for questions and answers, but should you have a question, please go ahead and pop it into the Q&A feature up there, and we'll get with that. So in thinking about not only COVID, but in the conversation of why we created PinPoint, we're going to look at this and we're going to walk through a couple of things. And so some level sets. As we talked about in the beginning, the conversation around being self-funded is an absolute must. And so I'm going to say this in a format of talking about, I want you to think about being self-funded in the context of how much of the dollar do you pay to an insurance company, or do you pay to your actual claims? And so when you're fully insured, you pay that entire dollar to your carrier, and that carrier does what they're going to do with it. They pay claims, they pay their employees, they do their administration, so on, so on. When you're self-insured, you pay that dollar, and a majority, 80 to 85% of that, go to the claims that are actually impacting your group and only your group. And why that's such an important feature is I want you to think about a couple of things about the current system and the way it was designed. And we talk about the word misalignment of interest. And so humor me here and say this in your head. A health insurance company, a public company, makes money how? What do they call revenue? And in your head, you should have said the word premium. The premium you pay a health insurance company is what they call revenue. And as everybody knows, a public company needs to grow their revenues to make profits so that they can appease their shareholders. And this is a slide that demonstrates just how well the health insurance companies have done since Obamacare. Now, if you remember during Obamacare, most of the health insurance companies were going crazy about how this was going to negatively impact them, et cetera, but their stock prices are up a lot since that time. And so I have to draw the correlation that says they're making more money. If their money is what you call premium, I'm assuming you're paying more premium than you were at that time. So are we aligned in interest with the health insurance companies? If we look at that on how we're passing that on, or how that increase in cost is related to what it is that your employees are facing, this is a slide that shows over the last 10 years, and obviously this ends in 2018, so it's only getting worse, what percentage of somebody's income is going to their actual healthcare costs? And as the blue continues to get more prevalent and darker, it gets to be a higher percentage. And so again, I ask you to think about that from the perspective of your own group. And this is one that is an interesting thing. So I want you to think about your last meeting with your health insurance carrier and the typical things that a health insurance carrier brags about, right? They typically brag about two things. They brag about how big their network is. Hey, every Dr. Jones and every hospital is in our network. And they also brag about how big their discount is. And so I'm going to pick on the word discount because for the longest time, over 15 years of my career, I never really understood what the word discount was actually applied to. And this is an eyesore. You don't need to be able to read this, but here's what I want you to take from this slide. One, the blue bars are this is Atlanta, Georgia. So anybody from Atlanta, you're going to recognize these hospitals here. The blue bar is what Medicare reimburses that hospital for a service. The green bar is what that same hospital bills out to the health insurance carriers. Okay, so you'll see there the ratio from billed to Medicare is 7.33 or 733% delta. So if Blue Cross, Aetna, Cigna, whoever is sitting in front of you and they're saying, hey, you get, the reason you're with us, Mr. and Mrs. Client, Mr. and Mrs. Advisor, the reason you're with us is because we get a great network discount. The next question you have to ask yourself is discount off of what? And so in this example, if you got a 50% discount, you got a 50% discount off something that's been overinflated 733%, or you're still paying north of 350% of Medicare. The other thing that I want you to take from this is the disparity between the cost of healthcare for the same exact services in one marketplace. So you'll see how big and fluctuates the green bars is that same group of services, but what each individual hospital bills. So in one city, Atlanta, Georgia, look at the discrepancy between the same exact services, but how much those hospitals are billing for it. And then the thing that really should chap us all is that orange line that's running through the middle of it, that's quality. So as the line goes from left to right, the quality gets from better to worse. So you'll see that there's hospitals on the right-hand side that have less quality that are billing at a higher amount. So if you had the opportunity to help your employees get to a higher quality facility, but at a lower cost, would that be advantageous? So take that out and extrapolate it from Atlanta. And we've just highlighted a couple of states. I live down here in Tampa, Florida, 901%. So when Blue Cross sits in front of me and says they have a 50% discount, my clients are still paying over 450%. That's outrageous. And so the reality of what we built PinPoint to do is to combat the healthcare cost conversation by bringing in a foundational part of quality and attacking prescription drugs. So I'm really excited to actually get to the meat and potatoes of this and introduce our speakers. So when we think of PinPoint, I want you to think of an entire solution all in one house. I think that's my number one thing I'm so excited about being a partner with the AccuSure Agency Partners is I build these plans outside of the AccuSure Agency Partners, and I have to come and find these different solutions and bolt them together. Here at PinPoint, all of these solutions were already underneath one roof. So the integration, the focus to client satisfaction and delivery and marching in the same direction was already there. So we're gonna start and dig into the health plan. So as everybody knows, you spend most of your money on your medical and RX program on your medical. So the handsome fellow you see up on the right corner, Trent Harper. Trent, why don't you introduce yourself to the audience for me?
Hey, Lester, how are you doing? I'm Trent Harper. I'm CAO here at PinPoint, and PinPoint is out of Las Vegas, Nevada, so it's nice and hot today. And we are a self-funding program administrator across multiple programs, but we're super excited about PinPoint and what that can bring to employers. And I think, Lester, you probably should have made my picture a little smaller. That's concerning a little bit for me, but that's okay. We can move on from that.
So Trent, as we think about a health plan, there are some things that all employers are always going to think about. So how we created PinPoint, how does that compare and hit on some major features as to what are the advantages from a normal traditional health plan to what we've created with PinPoint?
Yeah, that's a great question. So one of the first things that employers often think about when talking about their health plan is just the plan design itself, right? What you'll see as we talk through PinPoint is the flexibility, and the transparency through all of this. So the good thing is with PinPoint that whether we are matching your current plan design or offering a pre-built plan design, because of this structure that we're talking about, that you, Lester, have brought to the forefront of attacking the cost of the plan, what we see is the employers can have a conversation now and potentially offer richer plan designs because of the savings built into this. A lot of times we see employers stuck with having decisions of higher deductibles, higher co-pays, co-insurance, trying to tweak plan designs here and there so that they can knock that renewal increase down a little bit, so that they don't have to continue to cost share more and more with their employees. So I think it's a really important point that from the plan design perspective, we have a lot of options, and so that shouldn't be a concern for employers out there, because of this custom network strategy, the focus on quality, and everything you've talked about thus far. You can start to have other conversations around your plan offering that is really exciting.
So you mentioned the custom network strategy. So I want to hit on that for a second because, I remember advising clients back in my Willis days, and, Blue Cross would be the incumbent and Aetna would have a really good quote on the table. And then we would go do a network disruption, and always it's the CEO's wife, right? That her primary care doc is not in the new network, and so it doesn't make sense to move because we don't want this disruption. Talk to about the custom network design and how does that work?
Yeah, that's a good point. That's a great feature about what PinPoint brings to the table, right? When you were talking about the big savings, those big savings are in typically high cost areas, right? So that graph, going back to that graph with the green and blue bars, I think that was like a hip replacement or something, right? So most of the time, employees and members of a plan, they're interacting with their healthcare professionals in a routine basis, right? So that primary care physician, maybe that specialist, go and get some labs done, some blood work, whatever it may be. And what we noticed is that you really want to provide a broad network, right, to use terms that everybody's used to, of what doctor is in network, right? And so a lot of employers will jump from Aetna to Blue Cross or to Anthem, whatever it may be, to try to find that good network, right, that broad network. And so PinPoint allows you to, it's built off of a network platform, but allows you to customize it. It allows the employees and the members of the plan to add their doctors in a very straightforward and easy manner to the network, so that they feel comfortable and at home with those doctors, right? And so I dare to say that you can keep your doctors, right? We heard that, years ago, but in this scenario, it really is true. And so this is a unique aspect about PinPoint, because it is in the big behemoth networks, it's not necessarily a straightforward process to to add physicians and to add providers. And so that is a great aspect of PinPoint and something that is an easy transition from whatever network you're on currently, and is done without creating a lot of noise, right? A lot of that disruption that you might think of when somebody is really concerned that their, pediatrician is not in the Aetna network because they've been used to Blue Cross or whatever it may be. So hopefully that helps in understanding what that custom network strategy is.
That's fantastic. So, obviously, again, having had my own clients, I realize the angst that an HR professional or quite honestly, employees, when they're hearing and dreading the open enrollment conversation, right? Most of the time, someone is coming to open enrollment like, okay, what's the bad news you got for me this year? And so what's great about this so far is Dr. Jones is going to be in that new network. So that's fantastic. So, I hit on earlier the conversation around cost and quality. And the next 2 points on here and the next page are what you have written down as advocacy and quality. But talk to us about what this really means. How is this plan helping members kind of navigate the confusing world of healthcare?
Yeah, it's something that we see can really only be done in a self-funded environment, right? To bring the health plan, to make it transparent, to have control over what's happening. And so once you kind of, for lack of a better term, cut the ties with the network, you're able to kind of see behind the curtain. Your slides earlier was a great example of that, of kind of what's happening behind the curtain, right? And those questions of a discount off of what, right? And where is the quality? Healthcare is just an odd situation in our country right now where there seems to be an inverse relationship between the price and the quality, and no one really knows the actual cost. Right? We've all seen those EOBs where you have this enormous number on top, and you say, oh goodness, thank goodness that was in network because I got this big discount. But where did that big number come from? Right? What was the quality of that? And so built within PinPoint is the ability to really dig in and hit the true cost drivers of your health plan, which is the claims, right? And how do we do that? Well, we do that by cutting ties with the network, by helping to steer employees and members to high quality, low cost alternatives. So this might look like something that is very reasonable to somebody. Instead of having your knee surgery at a hospital, right, have it at a ambulatory surgical center or these specialty surgical centers, right, where quality is better, costs are low, because that's what that facility does. Same thing with imaging, right? Take an MRI. We all know that going to an imaging service, down the street, that where all they do is kind of those diagnostic imaging, versus doing it in a hospital, we know that that saves money. And saving money in healthcare doesn't mean lower quality, and that's a big takeaway, right? Being in a self-funded environment like this allows you to see what's going on, and like I said, look behind the curtain a little bit, and it's amazing the savings that we can provide employers, right? Because we can truly focus on quality and low cost where it really matters, and that dovetails perfectly into that advocacy piece, right? This happens because the member support and engagement and that advocacy, and I think we'll hear some of that later in the presentation, with a case study and kind of testimonial from someone on a PinPoint plan. But it truly is, sets this apart from what you would expect in normal healthcare. And so the biggest thing, biggest takeaway, I think, is just the exciting part of, having employers talk about something different when it comes up to renewal, rather than kind of the same old conversations, right? And this is just a great opportunity, I think, to bring real value to both the employer, the employee, and the providers, right, that are honestly treated through this whole process as, a part of the healthcare process.
That's a great way to segue right there. And what I want to tell a story, I always use myself as an example of now that I understand how healthcare can really be crafted like we did this PinPoint. I had knee surgery and I had a $5,000 deductible. So I went to the hospital my surgeon says to go to. And so the total billed charges was $90,000. I was on an Aetna plan at the time. And let's say the plan picked up $45,000. Well, I paid my $5,000 deductible and the plan picked up $40,000. Well, I do now know that 1.2 miles away from that hospital in Tampa, Florida, that I had my surgery, there is a place called South Tampa Orthopedic, which is an ambulatory surgery center that only does orthopedics. I now know in the style plans that we have created with PinPoint that the advocate would have made a suggestion to that plan participant, in this scenario, me, because the overall cost of doing it at that ambulatory surgery center, which all they do are knees, hips, and joints, was $20,000. So the plan would actually waive the deductible and coinsurance. So my portion of it would have been free, $20,000 plus my portion of it $5,000 versus the $40,000 that the plan picked up before, still is a $15,000 savings, while giving the member, in that example, it would have been me, a free surgery. And so that's exactly how these plans work. And it's all centered around transparency, but foundationally centered on top of advocacy. And so Trent, I always get this question, does it work? And this is a super busy slide, but what should clients take away from this slide, and does this plan actually work?
Yeah, there's a lot going on here. We're seeing all sorts of different services, lots of claims, billed charges and allowed, right? And so there's a few ways to look at this. A few slides back, you had that in Atlanta, right, that green and blue bar, right? And in Atlanta, we're talking about, on average, 733% above Medicare. And a discount, a solid discount from, a good network would be somewhere between, 50–55% off billed charges. And so what we are talking about here in PinPoint is that the average reimbursement is 164% of Medicare, which is equivalent to roughly that 77% off of billed charges, right? And that is a fantastic way to save money, obviously, and not losing quality, as we talked about. And so the big thing here is, this is what at the very beginning, when you opened and you kind of talked about this being kind of a non-standard plan, this is what we mean by that, right? That it is approaching healthcare, very differently, and using all these elements that we've talked about to really drive something that helps the employer to keep costs down, helps the employee to have access to care, all while making sure that the provider, and I mean, you can just see the number of cases here, right, that these providers are completely on board and you know, willing to participate, right, in this new solution. So great slide here of does this really work? And my answer is yes, it does.
Fantastic, fantastic. And again, a little bit of a call to action to everybody. So on your last renewal or your conversation with your current advisor or your current carrier, I want you to ask them, what's the network discount that I get today with your network? And they're going to tell you a number probably between 50 and 60 if it's a good discount. And I want you to see what this means here. And so you'll understand why these types of plans are saving you money when you make that comparison. So we talked about medical, and now we're going to talk into pharmacy. And so I'm going to bring in another expert, Miss Sarah Klein. Sarah, for the audience out there who's never heard of you or 44 North, why don't you give them a little bit of an intro?
Sure, thanks, Lester. I'm Sarah Klein. I am from 44 North. I am the COO. We're an Acrisure partner agency, third-party administrator, and what we're going to be talking about today are pharmacy services management. One of the things, of course, Trent was talking about medical, which does account for the majority of your spend, but 21% of total annual healthcare spend is on retail drugs. And we've seen about 100% specialty drug spend increase in the last 5 years. So going back, I really liked the visual you had up there, Lester, of the US and how compensation versus healthcare cost has changed since 2008. Michigan was still in the white, so we're all the way up here in northern Michigan, so that's a little bit nice to see. But for the most of the country, you're seeing that increase in cost, not just to you, but to your employees as well. And the way that we've combated that over the years, Lester, I don't know if you remember back in 2008, it was more common to see maybe a 1040 drug card. Now we've got 5 and 6 tiers of different levels of spend for employees. And we're starting to see where the way that we want to address that cost is, you know, how do we do things like step therapy and biosimilar switching? And now your PBM and your carrier is trying to tell your doctor, you know, no, maybe they shouldn't be taking that. Let's try this step first and the second step, and let's get to that. And, you know, with PinPoint, you know, I'm not a doctor. I didn't go to medical school. I don't know if you know that or not, Lester, about me. I don't have years of working with patients. I do, yes, I like to pretend. But what I'm really good at is shopping. I love to shop. And the goal with PinPoint is really to look at those dollars. How do we address those dollars without negatively impacting the benefit? Because the only one really that's benefiting out of the way that the market's been going is really the farm PBMs and the manufacturers and the carriers, but not so much employers and employees. So really what we're doing in PinPoint, both on the medical and the RX side, is we are taking a completely different approach. One of these things with this series that you're doing too, Lester, is I encourage people to follow through and do them, because you have to hear this like over and over again, because we're so brainwashed into thinking it has to be a certain way. You have to hear the concepts like 4 and 5 times before you go, okay, this makes sense. That I've been told one thing, but really we can create savings and create a better benefit for employees overall.
So, Sarah, talk to me about this specific. So I get the normal everyday drugs, but let's talk about what's really driving drug costs in the specialty drugs. And again, having, you know, being a nerd like you, I see the numbers. I'm going to take Revlimid because that's near and dear to my heart. So my dad was diagnosed with multiple myeloma in 1996, had a bone marrow transplant, and Revlimid is a medication that he was on for more than a decade. Now, what I never knew is what the cost of it is until actually I got into that profession. So Talk about these specialty drugs. I mean, we're talking 2-3% participation of employers, people are on these drugs, but they're more than 50% of maybe their drug costs. Talk about this and the type of program that you've done and the value not only to the member, but to the employer as well.
Right. So when we're looking at specialty and high cost drugs, right, all of those concepts that I mentioned earlier about what PBMs and what carriers are doing, they're focusing a lot on those lower cost drugs. And our pharmacy services lead likes to call those the peanuts. But everyone ignores the elephants, those huge high cost drugs that are really important to the members. But there's only 1 to 2% of employees or members on those drugs. And you're creating a lot of noise by focusing on those smaller costs when really we can target 1 or 2 prescriptions for every 100 employees. And a lot of times we can get those prescriptions completely free. Both to the plan and to the member. So again, a win-win, similar to on the medical side where you're a better benefit, lower cost to both the plan and the member. So there's 3 bullet points here on this slide about that specialty management program. And there's 3 different buckets that we go to when we're trying to find that. So there are lots of avenues out there. And there's a lot of ways that you can either qualify or you don't even have to qualify. They're just out there available, but you have to know where to find them and where to look for them. So there's programs, there's copay cards. You might be hearing about that more and more from your carriers, that one particular section. And then, you know, more and more you're hearing about international. And so that's an option too. You know, you can get a lot of your prescriptions at 30 to 50% of the cost as it is here stateside. Still the same medications. A lot of them come in the exact same packaging that you would get them here locally. But you're going to see that, and it's going to be an immediate saving. So 20 to 40% that you're seeing day one when these costs get removed. But your employees are getting the drugs. They're usually going to be getting them for free. And then the convenience of it even just coming straight to their home as well.
And just to recap your overall, so, you know, I don't want the audience thinking you cherry picked a couple of drugs and you know, a couple of clients. Talk to us about your performance and what you guys saw in 2019.
Sure. So 2019, we had 40 clients on the prescription program. We addressed over $6,000 drugs in one of those 3 categories. Right now, we are filling about 3,000 prescriptions monthly through the international program as well. And you're right, we're not just cherry picking 1 or 2. Really, what we do is we set a dollar threshold, right? We're focusing on the dollars. We're not just looking for one therapeutic class or anything like that. And so what we do is, you know, normally when we talk about these high cost drugs, specialty, we're looking at that 6-tier level. Those employees are probably paying $200 to $300 a month for those prescription. In addition, you know, plus your plan is obviously paying high dollars for that. And the goal is, how do we get it for free to them and to the plan? Can we remove the expense from current and then ongoing? And sometimes we jump from one program to the next, just looking constantly and being proactive on how can we get that drug for as little cost as possible. So for those 40 groups, 2019 alone, financial impact is basically we're saving $100,000 for every 100 employees.
That is just unreal. And folks, if you're listening, you're thinking that this is no way, no how, I'm telling you it is. We do it every day. And the Revlimid example I showed you, the qualifications of that is a household income under $100,000. And so what I'm going to tell you is, if you have a population and your employees, like to save money, you like to save money, and most of your employees make less than 6 figures of household income, this strategy is absolutely a no-brainer, because it doesn't require the employee to stop taking a drug, to change the drug. It is just merely how we're accessing that same drug. So Sarah, thank you so much. So we're running a little bit behind, but no big deal. I wanted to go into, okay, what does this mean for you? So you're listening to this and you're like, okay, is this a big deal, a little deal? And so I wanted to share some of the numbers we've seen thus far. And this is a pretty busy slide, but all it says is basically the average cost of a client that came to us last year was $7,900, and their renewal was taking them up to $9,100, where our average cost was $6,500. So now we're looking at a savings average of worst case scenario funded to the max with no exposure of 11 to 12%, or on average, we're looking versus and that's savings, folks. That is, you're paying less in healthcare next year than you are this year. But if we're comparing it to your renewal, we're talking north of 20% of a savings versus the renewal. So my call to action on that is going to be, if you're paying any level of an increase, you're probably paying too much. The top industries that we've seen thus far are senior living, transportation, and to include trucking and dealerships, manufacturing, and then obviously any impacted industry of COVID has been really, really great. So I'm super excited about this part, which is we're really going to hear from the experts. So Joanna, I'd really love for you to do two things. You are an HR professional. Your employer decided you were going to move on to this type of plan. You probably were thinking, oh my gosh, what's going to happen? Are my employees going to, revolt? Am I going to lose all my Christmas cards? I mean, what's going to go on? So if you could talk to us about your experience of moving over to a PinPoint style plan, and focus on a couple of things that I hear so much. Talk about that network thing that Trent talked about earlier, about people being scared about being self-funded and the claims issues around there. And then how in the world did you communicate and educate your employees? So if you could walk us through that, that would be fantastic.
Oh, hi, I'm Joanna Reagan. I am the HR representative at Breakpoint. I am in Las Vegas, as Trent said. It's only 100 degrees, so it's a good day today. So yes, we have some concerns. I am in a small HR team. So the first concern was being self-funded. It's just, it was different. I was very confused on, is it gonna be more work for us? We already taking care of so many things, and it actually felt great. Having the TPA, having that high touch customer service, employees felt, they were walked through the process of finding anything that they needed, and they always have given us super good, reviews and comments about that. So that was the first concern. Then the network. So I didn't know, so like you mentioned, people are used to their providers, and how are we gonna have access to the same providers that we have seen for years? It was the PinPoint program actually built us a network. So employees submit a form and they just nominate the providers. So the TPA works with them, and then they create these, they join this network. So employees felt that it was really easy and basically with no noise. The communication, it was a very important thing. How was I going to communicate this? We had to educate employees. Some employees don't really employees don't even know in June, what they were enrolled on. So I wanted to make sure that they understood the plan. So the communication was one of the most important things. So it was a series of different things. So we started with face-to-face meetings, bringing the TPA here. They explained, gave examples. We also have emails, different, we have even programs, we use videos. And then one of the best things was implementing the PinPoint benefits app, where employees get to see all the information about their health, their providers, in case of an emergency, how to call the TPA. We did these and more things, we even gave gift cards to employees so they could enroll and learn, and they were really excited about this. So the best advice is don't wait to the last minute. It's important that we start the communication process as early as possible. So the biggest takeaway is employees like their plan, they get all their needs met, and we're saving a significant amount of money.
Perfect. Joanna, thank you so much. And I love that you mentioned the app because, you know, it's one of my favorite things about the PinPoint plans is the app. And so thank you so much for, one, being a good advocate, but two, I know your employees love you too. So thank you so much for all your help. Now this is an interesting thing. So I always like hearing from a member. And so, you know, Sarah was talking about prescription drugs and things of that nature, and advocating for a patient and helping that patient get a better scenario. So Jeremy, can you walk us through your experience with PinPoint and what somebody listening might expect to hear from one of their plan participants? Because this isn't something that normally people hear out there in the marketplace under a traditional plan.
Sure. Good afternoon, everybody. So our employer chose to go with the PinPoint plans at the beginning of the year. And, you know, just like any other change, it was, okay, whatever. So our experience is that we've had one of our sons, my wife and I, one of our sons is a type 1 diabetic and has been for 14 years since he was just really little. So over the years, we have had a lot of different experiences obtaining insulin and other supplies, you know, relevant to his diabetes. And it seemed like in every plan, especially as the years have gone by, we have been the experts in finding the path to the best pharmacy or this or that, or we get blocked and we can't go to the pharmacy we want to, or we have to do this mail order. Anyway, it just, every time there's a change, we always know it's going to be a week or two of work figuring out what's going to happen. And I think a lot of people can relate to that. So when we joined PinPoint, somebody from the PinPoint team and the pharmacy team reached out to us and essentially they said, look, we see that you've got a high copay or a high cost to you. We'd like to help you reduce that. And we've never had that happen before, so that was interesting. So what they asked us to do is to switch pharmacies and go to a different mail order pharmacy, which we were happy to do, and, you know, no problem. About a month later, they reached out again, and they indicated to us that if we were willing to switch to an international mail order pharmacy, that our copay would be cut to zero. So for us, that's $100 to $200 a month. We were thrilled to be saving that money. And it was the same drug, no change, no difference, easy. They'd even called the pharmacy and prepped them and let them know we were coming. So when we called, it was all ready to go and easiest thing. And so when we were done with all of that, we kind of looked at each other and thought, this is amazing. In 14 years, we've never had an insurance company concerned about what we were paying. It's always been, these are the rules, this is, you can do this, you can't do that, or, you know, just a headache. And frankly, can't believe how easy this was.
That is an amazing story. I remember the first time I heard it, I'm still in awe. Folks, I want to paint that picture. Go to the same pharmacy, take the same drug in the same package, get it from the same, you know, pharmacist, and pay zero. So Jeremy was saying he's spending $2,400 a year on this one drug, and now it's free. And he didn't have to search this out. It came to him. So again, I ask, you know, to think about this is, when's the last time a health plan has reached out to the member to try to figure out how to save them money, which in turn saves the plan money? So it is an absolute win-win. So at this point, we are running a little bit late, but I did have one question that's in the queue. And Trent, so let's try to answer this as pretty succinctly as possible. You know, I've got in the queue, it's a longer question, but the sum of it is, self-insurance sounds scary. I've heard some horror stories. You know, can you talk about how, you know, we could set up the cost where they know exactly what they're paying and they're not going to pay any penny more?
Yeah, it's a very common question, and I think I'll also just kind of say up front, talking to your advisor about that will certainly help, and they can kind of walk you through the process. But essentially, within self-funding, you're going to be provided a policy, and it's a different type of policy, but it's going to cover any large claimants, so you're capped on any large claimants that might happen in your plan, as well as just the frequency of claims. So we call that a specific and an aggregate. And we don't have to get into the details of that, but long story short, what that means for the employer is that they're able to pay their premiums, you know, each month. And generally, you know, they expect to pay that. They get to see a whole lot more reporting, which is really neat, you know, of what's happening within the plan and where their money is going and why. And so it can feel very much what they're used to, right, of paying their invoice, and you don't have to be concerned or necessarily scared that that there's going to be some second dip at the trough, if you will, to try to get more money from you. So it's set up very nicely, and we encourage you to talk to your advisor more about that if you're not familiar with self-funding and what the industry calls stop loss.
So perfect. So, you know, to play the English terms for that underwriter actuary, Trent, it's going to look, smell, and feel and taste fully insured. You're going to pay your premiums on a monthly basis, and that's it. Behind the scenes, there's other things that are coming back. And the great part about it is if there's any money left over in the piggy bank at the end of the year, it's 100% yours. So in a year like this year where you've got a surplus in there, probably because, again, your employees haven't been accessing healthcare, you're still paying your fully insured premiums, but you're not getting any of that back in the PinPoint plans. Anything that's left there in the next year is 100% yours. So we're going to wrap it up with a little bit of a closing here that says, this is all about education. You can't buy anything on this. It wasn't intended to sell you anything, but this is episode 1 of 6. And so we're going to do these once a month. So go ahead and on your calendar right now, save the date for August 11th, where that topic about self-funding, we're going to dive into a little bit more and walk through the nuances of why being self-funded is the answer. You'll see every month after that, we're going to walk through a different subject, and these webinars will all be recorded. And so make sure you're signing up for them, even though if you can't make it, we'll make sure you get the replay. Now, I'm going to hope this works technology-wise, but if you heard this and you're like, man, we're going to be renewing here in January or anytime soon, or your client is going to, and you want to have an impact analysis. How much is PinPoint plans going to potentially save me? I'm going to hopefully launch a poll right now, and you should see on the screen right now if you would be interested in having a impact analysis done on your group. Just go ahead and let us know. All it takes is some very simple data, and you can get this. What you'll notice here on the screen right now is that there are really 21% reasons why you should consider this as a potential option for you. This client is about 110 employees, and you'll see here that they're looking at saving $278,000. So in the light of uncertainty of what COVID is going to do in the future, that at $50,000 is, you just saved 5 jobs. I mean, it's real money that we're talking about in that pursuit. And so all of this is just going to show you the way of saving that money. So I'm going to end the polling here. Thank you so much. If you do want to ever talk about that anymore and this impact analysis, please let us know. So it's the top of the hour. I'm going to leave you with a couple of thoughts. Albert Einstein says the definition of insanity is continuing to do the same thing and expecting different results, which took me 15 years of my career to notice that going out to the same carriers who have different interests and whose alignment on how they make money and what I want to spend on something is completely different. And if I don't change the way I'm approaching it, I would be insane to think that it's going to change itself. And so I'm really leaving that as a call to action for everybody to just ask some questions. What else is out there? And if you do have any questions out there, please reach out to the person that invited you to this webinar. We thank everybody for making this possible. And we look forward to hosting you on another call. Thank you so much. Stay safe and be on the lookout tomorrow for the replay email of this webinar. Thanks so much, guys, and have a great one.